Hi, this is Dr. Angela Cortal. I'm a naturopathic physician and I focus on regenerative injection therapy. This is one of the first in my series of getting ready and optimizing your injection therapy treatment. I wanted to start first with everything that I tell patients when we're about to go into doing injection therapies, whether that's prolotherapy or PRP, which stands for platelet-rich plasma injections. And so this is really my instructional conversation with patients, where I make sure that they're just set up as well as can be before we do the injections and what to look out for through and after. So first is meds. What are you taking, and does that at all interfere with the injection treatment? Some of the highlights here are blood thinners and also non-steroidal anti-inflammatory medications. Aleve is one of the most common ones. So if you're already taking those, you definitely want to talk to your doctor about it. You have to make an individualized plan for what is safe versus not safe to get off of. You don't want to just stop medications because I'm saying that they negatively interact. You need to have a conversation with your doctor to make a plan that's right for you so that you can safely control whatever you're controlling with those medications, or working to get off them if that is at all an option, in order to have the best outcomes for your injection therapy treatment. Next considerations is the timing of the injection therapy, and does that work well for you, for your work, for your exercise program. I don't want to be doing an extensive amount of injections and have someone do a competitive athletic event the next day. That would just be a recipe for disaster. So we want to avoid those things. Also, for those that have very physical elements to their job, whether it's being on your feet all day long, something where you're moving up and down, ladders or overhead work, or really anything. If you're using your body a lot for your job, then myself or your doctor who you're getting your injection therapy treatment through needs to know, so that we can plan that out. Do we plan it right before a 3-day weekend so that you have the time to recover? Are you already banking up some vacation time, and are we going to strategize around that? We really want it to be the most comfortable for you as possible, and also to have the best effects. Patients very often are taking the rest of the day off at a minimum with prolotherapy, and potentially a couple of days with PRP. We're all different, our bodies respond differently, but there tends to be a decent amount of soreness and achiness and tenderness in the area where we're doing the injection therapy. That's not a bad thing, that's an expected thing. But I don't want to send you into a world of hurt by then going into a very intensive work scenario or exercise situation. We want to make it as comfortable as possible. So with exercise, this is also very individualized depending on you, your goals, what you're training for, how physically active you are anyways. At a bare minimum, just being physically active will set you up better for the injection therapies. I really recommend patients have some sort of a physical activity training program that they're following, because if you're really not using your muscles at all, you're setting yourself up for having a very limited effect from the injection therapies. I really think just step one is exercise before you're going to invest your time and effort and energy into any kind of injection therapy at all, period. But how do you get back into exercise after the injection? It's a little bit still individualized, like I said, but generally just think of like we just... We're re-healing the body right here. We're re-stimulating a healing cascade. So we need to baby it. You need to be tender and sensitive to the area. We need to treat it almost like it's a new, fresh injury. We're reinitiating a healing cascade here, so you just have to be tender to it, sensitive, and treat it like it's a new sprain, say. For the first couple of weeks, it's okay for it to be mobile, but you don't want to strain it. If I'm injecting a shoulder, you're not going to go into the gym the very next day and try to see how many push-ups you can do. That would not be smart, that would not feel good, and that would also not be optimal for your injection therapy outcomes. So, tenderly, gently, we're getting back into exercise, being very cognizant of any kind of exercise at all that recreates the pain or is increasing any sort of discomfort in that area. So a few weeks out, someone still may be uncomfortable doing certain types of exercise. We talk about that. We customize their modifications. They may need to do less weight or do something body weight instead of weighted. It all just depends on the person. And then follow-up visits. So when do I want to see you, and when do we expect something good to be happening anyways? That's what patients really want to know. So with prolotherapy, it's about 2, 3, 4 weeks out, depending on the patient, the case, the extent of treatment we're anticipating. I would say for just a very ballpark average, about 3 weeks out, we're seeing the majority of the effect of the treatment, enough so that we can gauge what needs to be treated now. Were we treating 8 spots and now we only need to treat 6? Are we modifying? Did something new come up in the interim? So roughly between 2 and 4 weeks is our follow-up timing for prolotherapy. For PRP, it's a little bit longer out. It's a little bit more a stronger treatment, so someone can get increased soreness and achiness right after, and then also it's building for a longer period of time, so about 6 to 8 weeks out. And speaking of soreness and achiness, what's normal and what's not normal? Good question, I'm glad you asked. So what's normal and what's not normal? Tenderness, achiness, discomfort, not really wanting to use the area, but otherwise being okay to loaf around on your couch this evening, that's fine. That's typically expected. You're not going to want to really use the area much, but it won't be so severe that you're needing some painkillers or anything like that. That's not that typical. What we look out for is an extreme amount of pain. If there's any swelling, redness in the area, if you're feeling like you're sick, fever, chills, just feeling overall sick. That's why all my patients who are doing any kind of injection therapy with me are able to reach me any hours of the day. They have the after hours contact info, and if you're going elsewhere for your injections, you need to know how you can contact your doctor if you really are concerned in the evening time on the weekend, because it's rare that some complication like that should appear, but we really need to have a game plan in place for that. So all my patients have that information and can contact me if they have concerns. It's, again, really, really, really rare, but good to have on hand. So that concludes a lot of my pre-injection therapy information. And if you have any other questions, just leave those below, and I'll do my best to respond to all of that. To stay in touch, my website is drcortal.com. On Instagram is drangelacortal. And also you can subscribe to my YouTube, get notified of new videos. We're doing a whole set of them about injection therapies, and also I will be posting these to the blog on my website as well. So have a great day, and see you later. Bye.